Welcome back to the studio, Green Spring. Now I'm joined with the Medical Center Director, Dr. Sonia Bethel. Thanks for coming.
Okay.
So we're talking about generic drugs today.
Over-the-counter drugs.
Over-the-counter drugs. Sorry.
That's okay.
So is this becoming kind of a hot button issue, or is this just a needed update because we haven't talked about it in a while?
Well, I think it's a hot button issue because there's a lot of direct marketing that goes on now.
Okay.
You know, you see the TV ads, and they're trying to get you to, buy one drug versus another. And I think the other reason that it's important is that it's a time of year where there are a lot of probably self-limited illnesses, and folks will be going to the drugstore, trying to find out, well, what should I take for this and what should I take for that? But I think and then the third issue is that there are some medications that were previously prescription that are now over the counter. And I guess a couple of examples would be like the antihistamines, like Claritin and Allegra used to be prescription, now they're over the counter. And some of the acid reflux meds like Prilosec and Zantac, and Nexium used to be prescription, and now they're over the counter. So.
And is that a problem?
Well, I will say that the FDA generally is very strict in their research to try and determine how, whether a drug is safe or not. And if it's determined that there's a very large window saying that you could take a lot of this particular medicine and not cause damage, then it can become safe to become over the counter. And the other thing that the FDA really focuses on is, of course, is efficacy, like what amount of dose is going to take care of what problem. And you have to worry about interactions with other medications, have to worry about age, and you have to worry about other diseases that you have. So, I mean, there is a process that allows a drug to become over the counter.
So what we're trying to do today is just inform residents of how they can rely on their own knowledge to make the decisions about these over-the-counter drugs that will be safe for them, because previously they had a doctor instructing their dosage and the mixing and things like that.
Yeah,
Okay.
exactly.
That sounds important. So these are just over-the-counter drugs. We're not talking about anything generic or prescription. Okay.
Right.
So when did this happen, you said?
Well, I would say that probably within the last, say, 3 to 5 years, a lot of the transition has been made from prescription to over-the-counter. But the direct marketing, I would say, has been probably more active, say, in the last year or so. But it's going to be ongoing. We're going to see more of that, and a lot just depends on what the market is, and what's the profit margin that can happen if it becomes over the counter. So got to be realistic about what some of the driving force is.
Why did they make this switch? Was it strictly financial, as you're describing?
I don't know. I wouldn't say strictly financial, but you do recognize that a lot of people don't have direct access to a physician. So if they have symptoms, of course, you can go on the internet and find out, well, these symptoms might allow me to want this medication. So you get the medication, and then you say, okay, well, maybe this did help. And then if it doesn't, then of course then they can seek out medical care.
Yeah. So for a resident who's going to the drugstore that is having an allergy, or let's go with that as an example. And And what would you like them to do, things to think about or questions to ask the pharmacist when they're going to buy an over-the-counter drug?
Okay, well,
to help them prevent some of the problems they could run into with mixing and...
Right, okay. Well, one of the things that the pharmacist would need to know would be, are you on other medication, what prescription medicines you take. And we always encourage residents to carry a list of all their medications on their person at any time. So you talk to the pharmacist and you say, okay, well, I'm diabetic, or I have hypertension, or whatever, and then the druggist can potentially advise them on what might be a good choice. For something like upper respiratory symptoms or cough and cold, there are number of drugs that you could take. You might you can look for decongestants, you can look for antihistamines, you can look for cough suppressants. Those are probably the three, major categories when you go looking. But keep in mind that some of the decongestants can, they do what they do, they decongest, so they kind of dry you out. So you definitely need to counteract that with, increased fluids, okay? The other thing that sometimes happens with decongestants is it can cause an increase in your heart rate, so you can get palpitations. So you have to be very, very careful about that. And some of the antihistamines like pseudoephedrine, which was in Sudafed, that you even have to get directly from the pharmacist. It's not out on the counter now because it kind of got in the hands of people who wanted to. Yes.
I know what you're talking about. Yeah.
Yes, to have they ended up having problems with it. So you really have to be careful about those. Keep in mind that in general, something topical, like a spray, like a nasal spray, is going to probably cause less side effect than anything that you take orally. Similarly, anything that you can rub on, to the skin, is most likely going to be, cause less problems than something that you take orally. So you have to worry about your liver and your kidney, and the fact that just as you get older, your body doesn't process medicine the same way it did, 30 years ago. So those are things that you really want to keep.
And sometimes, if you mix things poorly, or well, I wouldn't say poorly, because sometimes you just don't know. Most of the time, you just don't know.
Right.
Then the side effects can be worse than what you're experiencing.
Exactly.
It's like, well, I don't know. I think I'd just rather have itchy, watery eyes than have liver failure or something because I mixed Sudafed with ibuprofen or something like that. So is it a good idea? Because I know when I've been to the drugstore before that you can. There's some over-the-counter drugs you can get off the shelf and then just go check out, and there's not a pharmacist to hand them to you. So is it a good idea for a resident who's buying something like that to still walk up to the counter and ask the pharmacist, hey, I'm on these medications, is this safe for me to take?
Yes, absolutely, it's a good idea, because I would say there's probably only a handful of our residents who are not on some sort of chronic prescription medication. So you definitely want to make sure that what you're getting over the counter is not going to cause a problem for you. Well, case in point, something as simple as Benadryl, which, when you're younger is perfectly safe to take. People use that, of course, for, for upper respiratory symptoms, and you can use it for sleep. But in our population, Benadryl, is really not that safe to use because it can make you too drowsy, and it can put you at risk for falling, and it can affect your cognition, your thinking. So you really do need to check.
Yeah, and that can be dangerous. And isn't Benadryl also in the over-the-counter sleep aids like Advil PM?
Absolutely.
It's just the Benadryl that's making you drowsy in that.
Correct.
Right? They just mix it with a pain reliever.
Right.
Okay.
Exactly.
Okay. So you have any more messages about over-the-counter drugs? Any warnings?
Well, I would say that for residents, they should be very careful about not using the drug beyond the expiration date. So you should be careful about that. Know how it should be stored. So if it needs to be refrigerated, obviously, do that. Definitely, be careful not mixing it with, other medications. I mean, it's always advisable, to ask your healthcare professional, is this safe or is this not safe?
Okay. Well, great. So I think we've covered it. That's just about it. Well, thank you for coming on, Dr. Bethel. I think this was a very important segment. It's always good to be up to date on safety, especially for medicine that one is buying for oneself. Yep, so we can be informed. Knowledge is power, as they say.
Yep.
Okay.
Absolutely.
So I hope you have a happy new year.
Thank you. You
and
too.
We'll see you next month.
Okay. All right.
So don't go away. We're going to go back to the choristers, and then we've got some Green Spring dancers to talk about the New Year's shenanigans. See you soon.